Great. Good afternoon, and this is our Monday report after, I would say, a holiday week with a holiday in the middle and quite divided. So we'll be looking at what has happened over the past number of days and what do we look forward to in the week coming up in the data and the information and materials. As you've heard from the Premier at 1 o'clock, we did review and have had consultations back and forth with the Medical Officer of Health, Dr. Ahmed, in Windsor, Essex, and discussing both the data there around the outbreak in the farm setting, as well as the ongoing data in the community level of the Windsor, Essex region, the public health unit, and with the advice and direction there because they have contained the outbreak at the farm location, which is a very large farm location. And that was a lot of work over the weekend by all different sectors and with an excellent relationship working with the owner to keep operations going while maintaining the safety and health of the workers. And so as a result, we have recommended to the Premier, who is putting forward to the Cabinet under the emergency orders to move Kingsville and the municipality of Kingsville and the city of Leamington up to a stage 2 level as of tomorrow. So that's good news there. So as I said before, we've had a lot of excellent work breaking new areas with how to make and work with the agri-food industry of a large institution, which this one is, one of the largest in North America. And also we've been working at the other things in the municipalities to see what is the difference between outbreak cases versus those in the community. And you're going to hear some numbers today from Dr. Yaffe as we try to understand where we are in this progress of stage 2, where we are at different steps along the way, since we've had some health units, the original group have had over 3 weeks at stage 2. Some of the next 7 are just completing, getting close to completing 3 weeks, and we've had some like Toronto and Peel are finishing off and getting close to 2 weeks, and Windsor, Essex, without the communities of Kingsville and Leamington, have had about a week and a half in that. So we're all trying to get the data together to see how well have we done under stage 2 before we want to consider any directions for moving towards stage 3. We've also noticed that in this time, we have seen outbreaks occur in different settings, personal service settings, as in Kingston and London. We've had some with social gatherings of those who have not maintained the social distancing, and those have been followed up by public health with notification of contacts and finding even further members of those groups that are positive. And some of these, while they seem to be a small entity, such as in Kingston, you have over 700 people impacted in that time period. So what seems like rather small things can become quite large. And as we've noticed in other parts of the country, even Prince Edward Island, that's had no cases, all of a sudden due to some changes and people not following the proper protocols, you end up having cases that you haven't seen for a while. So while one may be able to keep the numbers low, one should not let down your guard and assume that you will not have cases. You always have to be looking for and understanding what those are and move on them quickly to contain them, as they seem to have done in Prince Edward Island, and Nova Scotia was responding accordingly. So applaud the public health sectors there, Dr. Strang and Dr. Morrison, for quick action in that regard. And it's a message to all of us, even if it's looking good, you're going to have to keep your guard up and keep watching and looking for those cases, as we've been trying to go forward with a strong case contact management and containment process as we try to complete off stage 2 here. So before I put any more comments there, I'm going to hand things over to Dr. Yaffe to look at the general trends and the numbers that we're seeing at this time of Monday after the holiday weekday.
Okay. Thank you very much. Good afternoon, everybody. Overall, our case counts in Ontario continue to go down week over week after a very small increase in mid-May. We've had about 138 new cases in the last 24 hours reported. Recent trends are showing that the highest percentage of the cases are being reported in the 20 to 39-year age group, followed by the 40 to 59-year age group. So that doesn't mean that the rate of numbers is going up, or of cases is going up. It just, as the total number is going down, we're seeing a higher proportion of cases in younger people. We are very encouraged that the number of deaths continues to goes down every week, as the total deaths per week has not exceeded 50 for 4 weeks in a row. And actually today we have had no cases of deaths reported in Ontario. The number of Ontarians in hospital or in ICU or on ventilators has also remained low. With respect to the numbers over the last few days, the vast majority of public health units are reporting 5 or fewer cases daily, with many recording 0 cases at all. No new cases, which is wonderful. For today, of the new cases, the majority are in Peel, Toronto, and York. Halton and Ottawa have also recorded higher numbers after several days of low numbers. Our testing numbers on average have remained above 20,000 tests a day since June 10th, while the percent positivity has been going down. It's down around 0.4% now. So what does this mean? It's all very encouraging, but we do want to once again remind Ontarians we all need to continue to follow public health advice. Please remember to maintain your physical distance from those around that are outside of your social circle. Remember to stay home when you're sick. Regularly and thoroughly wash your hands, and wear a face covering when physical distancing is a challenge or not possible. Any further loosening of public health measures must be done cautiously and safely, and it can only be done with everyone's help and cooperation. Thank you. I'll turn it back to Dr. Williams.
Okay, well, thank you. And I think the last points you're making were very important. We've had some more input from our modelers that have shown that while we have aspects with our testing and that, the major impacts with success of bringing the numbers down have been the public health measures, namely the distancing, the staying at home aspect, the wearing of facial coverings in public settings, and that as we go forward with further stages, a strong emphasis to say, please pay attention to that and do what you can to maintain those preventative aspects as you open up more businesses, more public settings, more venues, etc. in that aspect there. And so as we look at how we're doing in stage 2, it's really asking our public, as you get into more in the public settings, as you move more out into the social areas, as you do your social circles, are you doing it in such a way as you're being consistent in your discipline around the distancing, wearing a facial covering in a place, a public setting, and you're hearing more and more health units putting in local mandatory requirements in internal settings as well as on transit and different settings to ensure that there is consistency and adherence to that. At the same time, when you see these numbers coming down, it's interesting that we've had nearly 2 weeks of under 200, except for certain days. And certain days when we've seen that, it's been a cluster around an outbreak or a number. And that has been interesting to see, even if you watch Toronto sometimes dropping down to below 50 and then jumping up again, being aware that Toronto is investigating a number of outbreaks in workplaces. Peel is doing the same. And so are our numbers evidence of widespread in the community, or are we now getting into a containment phase where most of the health units are looking at a cluster here, a cluster there, where you may have no cases for a day or two, and all of a sudden you find a cluster like Kingston, and you go up from 0 to 25 or 30, and then back down to 0 again. So we're trying to understand how that plays out and looking at the quality and integrity of our containment methods, because those will happen from time to time throughout this process, and we want to be assured that that is robust and working accurately in there so that the public can be assured that while you have a number of cases in this workplace or this institution, it's not out in the public writ large, but then you have to know how did it get into there, much like you saw in the report over the weekend with Prince Edward Island, tracking back to where they found the cases originated from. But still, those messages that Dr. Yaffe alluded to, we have to maintain those and continually see if they can be put in place, even as we move forward, potentially into other stages. Can we be consistent in that approach? Do more, but do it more carefully in that sort of dichotomy of directions there, but both are critical as we deal with that. So with that, we're looking at the week ahead. How will everybody do as we collect the full data around stage 2, as more and more of the health units and areas have completed 3 weeks going on to 4 weeks of data, and that will help to inform us when we can consider going to stage 3 as our public health measures table are reviewing that, and other committees in the government looking at different aspects that would be related to a stage 3 level. So lots of data, lots of analysis, lots of further testing going on in different settings as we deal with new entities such as the whole thing with the farm response and how did we handle that, and on a go-forward basis, other settings that are of difference, different realities, different challenges, but still one that you can carry out a containment method that keeps workers safe at the same time of trying to maintain the quality and the work of the organization. So with those comments, I'm going to hand things over to media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up, and please join the queue if you have any questions. First question
will be from Randy Rath at CHCH TV. Please go ahead.
Sorry about that. Hi. I'm wondering, when you give out the daily case numbers, when were those tests performed? Like, is that a snapshot in time that's 2 weeks old, or is it 5 days old, or how does that work?
Well, I'll start, and then, I think I don't have the data right now on turnaround time, but I know that I think close to a majority of the lab reports are within 24 hours, and then a good number of them are within 48 hours. There are a small number that are longer than that, so they probably represent the last 24 to 48 hours.
And I would agree with that. I think there's the process of collecting samples from distances, sending them in, getting to the local lab for intake, whether it's a hospital lab, whether it's a public health laboratory or a private one, and then they being taken through their process with their timing. Those results then uploaded to the central with OLIS data system, and also then recorded into the IFAS system. So if you're asking the numbers we use today, we're talking about ones generally that at least happened 48 hours ago, if not longer, as they entered in and do their case contact management. So we allow that proviso in there. So today's, Mondays, we would usually think they're the ones that are submitted on either Friday or Saturday, mostly Saturday.
follow-up.
Okay. You see in other jurisdictions they're using saliva swabs as opposed to the nasal swab. Why aren't we doing that?
Well, I think you're talking about saliva tests versus swabs, right? So there's a difference there. We've been asking our public health laboratory experts and other laboratory experts on usage of those different tests. There seems to be a sense that the nasal swab, that's not the one that goes all the way back, the thin one, that could be used much more easily while not being as high efficiency or effectiveness as the NP swab is pretty good. The saliva test, our laboratory systems still have doubts about the quality of that test, especially its sensitivity in that, because there's a difference between saliva, just spit, and liquid in the mouth, and what's the quality and how can one produce a good sample that would be valuable. So the technique and the methods of obtaining it are also being questioned. So we haven't gone yet or had approval from our laboratory experts to go to saliva testing at this stage, but they are looking seriously at the value of nasal swabs as compared to nasal pharyngeal swabs. That's the NP versus the anterior nasal type area swab. Does that cover your question?
Yeah, that's good. Thank you.
Thanks.
Next question, and this will be the last question unless anyone else joins the queue.
Next question will be from Chris Enfing at CBC News. Please go ahead.
Hey, folks, I'm out in Windsor here. Just a question about the testing on farms. Do you have an estimation of how many farms and workers on farms have been tested in the Leamington and Kingsville area with this on-farm testing?
I had the sheet in front of me that they've done so far, the ones that are undertaken completed, the ones that are undertaken still tests pending, and the ones that are going to be undertaken more tests pending. So if you're asking me off the top of the head to be accurate, I would get it wrong. There have been quite a few tested already. We have the 2 places so far that have identified, as you remember, the first one was the 28 positives, and then we had this larger one with the 191 positives. All the other ones I've seen thus far, and the tests have come back negative, but some still have lab tests pending, and there are a number of other institutions in that area that they still are going to undertake testing in this week ahead. So it's in process, and we hope to have those cumulative numbers present for us once the OH teams have completed that phase of the project.
Follow-up?
Okay, thanks for that. And a follow-up here is just that the testing being done, that's by Ontario Health Teams, not WeCHU, our local health unit. And are there going to be retesting like we saw at long-term care facilities, or we're seeing at long-term care facilities?
The answer is yes, in certain circumstances. At the one, for example, if you're talking about the farm one, the one where we did test some people and they were negative. Some are off-site. If they develop any symptoms, we would then retest those ones. The ones that are in the positive asymptomatic group, if we can use that term, generally if they complete their quarantine period without symptoms, we really don't have to retest them. If they do develop symptoms and are concerned, there's still the proviso that someone like a healthcare provider, OH, could request retesting at that time. And there's other cases in that. The ones that you may have to do repeat, if you have someone that you tested positive and they test positive again, you may have to do it again. So it's very much individualized, but most of the ones we're concerned about are the ones that were originally tested negative but were exposed in the setting to other positive cases. If they develop symptoms, then we will want to retest them to make sure they haven't converted to actually positive cases, and then have to be monitored closely for severity of symptoms and to make sure that they are not, they do not get into any health issues that would require hospitalization and further intensive follow-up.
Next question. This will be the last question.
Will be from Scott Lightfoot at CTV News. Please go ahead.
Thanks, doctors. Just wondering, you mentioned that it was encouraging news that Ontario reported no fatalities today. Wondering if you consider this a milestone or if you look at this more as sort of a one-off, and should people continue to expect to see a lower number of fatalities, but not necessarily zero going forward?
Yeah, it's great that we have zero reported today, but that doesn't mean we'll continue to have zero. Hopefully the numbers will stay low. And, we have less people in hospital, less people on ventilators. So all the signs in less cases. So all the signs are that we're having less and less cases, less severe cases, and hopefully less deaths.
Follow-up. This will be the last question.
No, that was great. Thanks.
Thanks, everyone.